Hi guys, so in today's lecture we will talk about tuberculosis. In tuberculosis we particularly talk about mild grade fever with evening rise. Why this evening rise? This evening rise is not because the bacteria becomes romantic in evening hours. This evening rise is in fact due to physiological variation of body temperature during morning and evening hours. In evening hours temperature is higher as compared to morning hours, and this bacterial infection adds few degrees to already increased temperature during evening hours, resulting into subjective feeling of fever, particularly during the evening hours. And apart from these constitutive symptoms, patient also suffers from night sweats, weight loss, lack of appetite, etc. Okay, so let's talk about tuberculosis in detail. Nowadays, instead of staining and culture, if facilities are available, you should go for CBNAAT, that is cartridge based nucleic acid amplification test based on polymerase chain reaction. It will detect the DNA of Mycobacterium tuberculosis. It will also detect the presence of resistance, particularly against rifampicin, so that you can classify this particular case of tuberculosis as drug resistant or drug sensitive tuberculosis, because nowadays treatment is based on whether a person is having drug resistant or drug sensitive tuberculosis. Okay, so after smear examination, or in case smear examination comes out to be negative, you can subject this sputum for PCR, that is CBNAAT, and in this particular case you can get the report within 1 to 2 days, whereas in case of culture either in LJ media or in liquid media it will take more than 3 weeks. Okay, therefore nowadays this should be investigation of choice. So your sputum should be subjected to CBNAAT, that is cartridge based nucleic acid amplification test. This will detect DNA of Mycobacterium tuberculosis, plus this will also detect if there will be presence of resistance to rifampicin. Okay, too simple to understand. Therefore this particular test will help you classify drug sensitive and drug resistant tuberculosis. If you happen to see resistance against other drugs other from rifampicin, you can go for line probe assay. This will help you detect resistance against second line anti-tubercular drugs as well. So here you can appreciate your GeneXpert, that is your CBNAAT, that is your investigation of choice nowadays. Okay, this can detect DNA of Mycobacterium tuberculosis. This can detect resistance against rifampicin, that is your first line anti-tubercular drug. Therefore it will help you classify as drug resistant tuberculosis or drug sensitive tuberculosis, and now you have to treat accordingly.